We're live, my brother.
All right. Well, welcome to another Cutting Edge. And of course, this program is being brought to you by the University of Maryland School of Public Health. I'm Omar Neal. I'll be one of your hosts. I'm the former mayor of Tuskegee, Alabama, as well as the host of the You Got the Power radio talk show. This month, we celebrate Black history. In fact, every month we celebrate Black history. Black history is not just for people of color. Black history is everybody's history. And so we are appreciative to have this last day in February, which is designated as Black History Month, to talk about the issue of trust. And we have a wonderful panel to engage in this most important subject. Don't forget to follow us on Facebook, YouTube, Instagram, and Twitter. Make sure you like and share. And of course, each and every Thursday, you can find us right here, 7 to 8:30 Eastern Standard Time, 6 to 7:30 Central Standard Time. Well, today our conversation is going to be about building infrastructure of trust, one person at a time. In fact, we have some public health professionals discussing ways and means to establish sustainable, trusted relationships between the government and the communities they serve. But before we do any of that, I'm going to bring on my sidekick. We call it Dr. T and me, Dr. Stephen Thomas. Dr. Thomas is going to be hanging out with me. He's one of those public health people. And so he's right in his wheelhouse as we talk about this notion of trust. Let me do this, Dr. T. Before we do this, let me kind of introduce our panel at least. Or you know what? I want you to introduce the panel this time. What about that?
Well, first of all, it's good to be here with you, Mayor Neal. And on the last day of Black History Month, I'm gonna lift up the spirit of Harriet Tubman.
I see that. I love that T-shirt, man. That's nice. Oh, the Underground Railroad. Yeah, I like that.
We have a museum right here in Maryland, so we have her DNA with us. Let's bring that spirit to our show tonight. What a lineup we have with these public health professionals who have been on the front lines coming in for a report. You know what I mean? Coming in for a report to talk about what's working and how we can help them spread the word.
Yeah, and again, when we are talking about this issue of trust, we talk about it oftentimes that trust is a calculated risk, right?
There you go.
And you make your friends before you need them. And so we're going to have a really interesting conversation. Man, we're going down to Arkansas. You know that, right?
Well,
right?
Mr. Mayor, what I'm realizing is that the folks are waking up to what needs to be sustained as we come out of the pandemic surge and all these mitigation measures being lifted. We've got to stay the course, and we need Harriet Tubman more than ever to help people know how to stay protected. We're going to hear about that tonight.
Absolutely. Well, you have a special person up in the Maryland area that hangs out with you. I want you to introduce her first, and then we'll go to our other guest from Arkansas.
Well, I am so happy to have Dr. Tiffany Dyer here with us tonight, and you'll bring up her bio. She's an associate professor in our Department of Epidemiology and Biostatistics, and I'm proud to say I'm one of her mentors. And I'm realizing that you could read all about her right here. You can see she has some style, and she is a scientist. And one of the things that I remember is the realization when she knew the difference between a mentor and a tormentor. And now
I like
she
that.
is as a tenured associate professor in the School of Public Health. Let's put some snaps together for Dr. Tiffany Dyer. Come on now.
Hey, Dr.
Unmute
Dyer,
yourself.
how are you doing?
Unmute yourself.
Oh, I'm doing wonderful. That was a wonderful introduction.
So
Thank
wonderful.
you so much.
What you would like this audience to know about who you are and what you do and why you do it.
Okay. I am a community engaged researcher. I'm an epidemiologist. And the work that I do is involved in understanding the ways that intersections of race, gender, any social position that you occupy all at once, how that has an influence on your lived experiences and how you live your life. And because I'm an epidemiologist, I'm talking about disease, but I'm also talking about well-being and resilience and some of the things that we can actually link on to and with our community to help them understand that the power lies within them to live the best lives that they possibly can be. So while Dr. Thomas wanted to channel Harriet Tubman, I want to channel Sojourner Truth tonight with Ain't I a Woman, right?
Okay.
And what she's talking about is being a Black woman at the intersection of race and gender. And again, thinking about the power that we have as a community to really take hold of our lives, and that spiritual, physical, mental, emotional, and just health and well-being in general.
Wow.
And that's me.
You know,
Wow.
Mayor Neal,
Yeah.
Mayor Neal, I have had the opportunity to observe Dr. Dyer evolve and grow as a scholar. And for many of the people that are listening to you tonight, they are maybe meeting an epidemiologist for the first time.
Absolutely.
So can you explain to the audience, what is an epidemiologist? Get it down to where the cows can get it, as the mayor likes
Okay,
to
I'm breaking
say.
it. Break it all the way down. You know why? Because I have to break it down. I was just talking about the fact that my mom had to break it down to her, because when I got my PhD, she was still unclear about what it was that I did. And I found it hard to explain to her until, unfortunately, or fortunately, until 2 years ago with COVID. And I told her, I said, Mommy, what you see on the news every day, that is what I do. That is what an epidemiologist does. We count cases. We want to understand the distribution and the determinants of disease and wellness, but more often than not, a disease in populations. So I said, unlike medicine, which a clinical medicine, we need it. We all know that. But my job as an epidemiologist, as a public health professional, is to see to it that you don't have a lot of patients. So I want to see to it that I don't want you to lose your job. I want you to have a job. But I do want to see to it that our communities, our population, and particularly for me, Black folks are healthy and people of color are healthy, so that they don't have to have, go secondary and tertiary prevention methods. We want to go primary. We want to prevent that.
Did she get it? Did she get it? Did she get it?
Epi.
Did she get the explanation once you gave it to her?
Yeah,
absolutely. Now you have to mention the fact that your parents are from the South now.
Okay.
You cannot forget.
I cannot do that.
Absolutely.
My mom. Yeah. So again, my mom is she's from Alabama. My dad is from Macon, Georgia.
All right.
And then again, like I said, I'm, like we talked about earlier, I'm from the South, but honestly, I'm from California, but I'm from Compton. So they moved to Compton when Compton was white.
Wow.
And I'm born and raised in Compton, California. Right now, when I go to my mom's, that's where I go to Compton.
All right.
And there wasn't a lot of hope that I would get out of Compton or that I would go to college or anything. And so me, along with, a lot of good things come from Compton. When I got my PhD, my mother wrote a little piece in the local newspaper that said, good things do come from Compton.
All right.
And that was her writing up. And then she loves Venus and Serena.
Okay.
They from Compton. And then we know Dr. Dre and everybody, we know the whole hip hop thing, right?
Yeah.
But she really, really was proud of that. And the fact that it was showing that, we've got a lot of strength and again, in our communities. So I'm thinking about where I live now in Prince George's County. We got a lot.
Right.
And we gotta really just touch people's hearts in that way so that they understand that they have the power to take control of their lives. Once you get through the systemic and the structural stuff, I mean, that's the problem. But beyond that, at the personal level, we do have some power over our lives if we can.
More is caught than is taught. People learn best by precept and example. So to see somebody like you,
absolutely,
and to tell your story, because people can see your glory but don't know your story, right?
That's right.
Right. You see what I'm saying? And so it's important that you do that. Thank you so much,
Thank you.
Dr. Dreyer, for being a
Thank
part
you
of this
very much.
discussion today. This is going to be wonderful. Dr. Chi Smith, let's go down to Arkansas for a second and bring her up. And as you know, she's the interim director of the Office of Health Equity in Arkansas Department of Health. But Dr. Chi Smith, how are you doing today?
I'm doing really good. How are you?
Fabulous, wonderful, supersonic. And what I want you to do is, in your own way, tell the folk who is Dr. Chi Smith.
I'm me. I'm a Black woman, an immigrant from Nigeria, and I grew up or spent most of my time in Miami, Florida. I ended up in Arkansas when I got married, and so marriage brought me to the South, Arkansas. But the work that I do and who I am, I'm very passionate about health equity. I see myself more than anything as a health educator. And my goal is to bring knowledge and have conversations with people in the Black community in particular about their health and help them feel empowered to make decisions that would help them improve health outcomes. So I like to look at it from the granular level, not just from behaviors, but from the systems and environments that drive those behaviors. Wow. And I use education to let folks know about those systems and those environments that can drive the behaviors that end up with negative health outcomes. And so wow. if I can reach one or two people, I count it as a win, because I know those people will also go out and talk to other people. And I'm happy to be here today, and I hope to be able to learn from everybody and from this conversation.
I'm so glad to have you here. Now, let me tell you something about Arkansas. I have a dear friend who lives in Little Rock, Arkansas. She's like a mother to me. Her name is Lucille Cameron. And she's so sweet that if you're around her long enough, you're going to get diabetes, because she is that sweet. She is such a wonderful person. She's watching us now. So much love to you, my mother, Lucille Cameron, and my sister, Diane Cameron, is as well, just a close family knit. Just love her so much. And so to know that you are connected to her by state and all of that just gives me a warm heart to know that. Well, let's go and bring some more folk on, Dr. T.
Well, let me say, as we're making that transition, Mr. Mayor, I'm meeting Dr. Smith also for the first time, but it has been folk coming out of Arkansas that has brought us together. So we got some more folk out of Arkansas coming up.
Yeah, let's bring up Mr. James King. If
there we go.
Let's bring him into the house, and he is the public information specialist for the Office of Health Equity, Arkansas Department of Health. And we had a wonderful conversation with him earlier this week. And Mr. King, how you doing, my friend?
I'm doing fine. Thanks for having me.
Good. Tell the folk about you. Who is Mr. James King?
Mr. James King. Well, first of all, I started off where you're at right now in radio. That's how I started. Yeah, I started in radio in 2003. I still do radio. I started off at the station 92.3 in Little Rock for about 16 years. Then I went over to the streets, then at 96.5, and I also do satellite and other stations around the states, mix show. And so with that being said, I've been in communication all my life. So I went back to school, got my BA, then I just finished my master's, achieved my master's this past December.
Man, let's give it some snaps. Hold up, let's give this dude some snaps. We got to give you some love, man. We got to give a brother some love, man. That's an accomplishment, man. Yes. We don't just go past that. Congratulations, man. Absolutely.
Thank you. And that's how I ended up at Arkansas Department of Health. And I must say I have a wonderful team, and I have to brag on my supervisor. I had the best supervisor in the world, Dr. Chi Chi Smith. And I tell you what, she challenges me. I'm talking about, I've never thought this hard on the job. And she knows how to push me and bring out the best. So I'm blessed to have a supervisor in her.
Well, thank you so much, my friend. It's so good to have you with us. And I'm just looking forward to this conversation today. And then to know I'm doing it with another fellow radio personality, man. You know, that's a special, you know how to reach my heart, right? To be part of this this brotherhood and this fraternity we got called radio, right? That's really important.
And speaking of brotherhood, I have to give it out to the best brotherhood out there in the nation, 1911, Kappa Alpha Psi.
Well, I knew you had to go. I knew you had to go there. KA Psi Nu Pi.
That's right. That's right.
Absolutely. All right. Let's you know, we got a whole lot of folk we're gonna bring on. Let's see if we can find Danny Baxter. Hey Danny, how you doing?
I'm doing well. Happy to be here.
Good. Now, Danny is the population health analyst at the Office of Health Equity at Arkansas Department of Health. Hey, Danny, how you doing, man? Everything's good?
Everything is great. Happy to be here.
Good. Wonderful conversation we had with you. And you bring a unique perspective in terms of looking at people and the population and its integration with health and health departments and the government, and that's what we're going to really focus on today, Danny. So tell us a little bit about yourself.
So I think at the core, what has brought me here is that I am a person who believes that access to wellness is a human right, and I believe that the way that we bring that about for all people is to meet those people where they are. That's kind of the tagline for the programs that have come out of our office is, identifying that at this point in time, basically everything is a barrier to care. And so when we think about our programs and we think about our policies and how we bring health to people, we want to do everything that we can to eliminate those barriers. And that's really what got me into public health in the first place. I actually got my bachelor's. I got two of them, one in English and one in Spanish. I was going to be a lawyer. That was my plan for a really long time. But then I just so happened to win a Fulbright Award. After college, I went to teach English in Columbia for a year after I graduated undergrad. And it was over there that I realized that I had such a passion for health because there are so many people who, without this access to wellness, they can't thrive in any other faction of their life because they're too busy just trying to survive. And that's what brought me here. So now I am in the middle of my MPH, my Master of Public Health at the University of Arkansas for Medical Sciences.
Hold on, let's stop and give him some props on that. We got to give him we got to give you some props, brother. Go ahead.
Yeah, so I'm just about one semester out for that, and I'm very excited to utilize that in my job and to keep being the best public health professional I can be.
Well, thank you so much, man. We are so appreciative to have you join us here on the Cutting Edge. I want to start with you, Dr. Dyer. If you could help me out with this, because we said that we were going to talk about trust. Right. And we know that trust is a calculated risk. We know that, there are a lot of reasons, particularly as we speak to communities of color, to not be trustful of the medical industry or the public health industry. Right. Me being the former mayor of Tuskegee, Alabama, me living in Tuskegee currently, how we can really have legitimacy in our distrust for the government, right? Help me to understand not just why we have legitimacy to distrust the government, but what have you seen in your assessment of how the government is changing things where they can tout they are being trustworthy?
You're muted.
You need to unmute.
Sorry, that is an excellent question. So as you're saying, we do. I remember when, again, a couple of years ago with COVID, I wrote a piece in The Wave, which is a rag in Los Angeles, because I wanted to talk to particularly the older population about the reasons why they should get vaccinated and boosted. And in that article, I did reach back and again validate the reasons why. And we, like you said, have legitimate reasons not to trust the medical establishment for a number of reasons, Tuskegee being one, right? And the one thing that I will say is that I think the medical industry has more work to do. I think one of the things that we need to do is develop a workforce that looks more like the communities that we're working in, right?
All right.
So a lot of, so there's a lot of, stuff around, patient-doctor racial concordance and whether or not people are more likely to adhere to whatever their doctors say if the person looks more like them. And then there are studies that say that they're less likely to do that because they feel that level of, like, this person might be somebody I might see at the grocery store. So I really I might not want to tell them that I have a lot of sex partners or that I'm an active drug user or whatever the thing might be, right? And so, but the majority of studies show that if the doctor looks more like you or that researcher looks more like you, that you're more likely to develop a sense of trust. I think developing the workforce is important. I think reaching back to, I'm not even back, I'm going to say forward to HBCUs, getting people involved in the research endeavor on any level. I think as researchers, one thing that I do is I don't walk in with the PhD on my jacket. I walk in, I'm Tiffany. Let's talk about what's going on with you. Right. And I'm just myself. And by the time the people figure out that I have a PhD, they're like, baby, we're so happy we didn't know. I'm like, that's not the most important thing. That's literally, they'd be, oh, baby, you're supposed to. And I'm like, no, mama, it's okay, kind of thing. And so I think that and another thing that I think we need to do is we need to reach our youth. I think the children are our future, like Whitney Houston said. And I think that we need to pull them into the research enterprise because, again, they have a voice and they know how to reach their communities in ways that I'll say even people like myself who are kind of aging out might not be really up on that game. Like social media, I'm like, oh, you know what I'm saying? So I think, again, I said we have a reason for the distrust, but I think to build trust, we need to develop the workforce, engage the youth, engage in funding HBCUs, and again, stop with this whole who's getting funding, who's not. I know a lot of my colleagues looking just like me, writing the same grants, but by the time we do the community engaged work, that takes years. It takes a long time to really get to know the community if you really love the community. And we don't do helicopter research. So by the time I develop a relationship with the community, someone so over here done wrote 50 papers, right? And so that's what we're being evaluated on. So it's this race. I'd rather engage the community and really, really have them tell me what I need to do so that I can develop their trust so that we can achieve equity and health. And I think that's what we need to do.
Mr. Mayor, let me just say this, because I have to point out the kind of scholar that Dr. Dyer is. And as she described, it is difficult, but in the right environment and with the right mentorship and support and an institutional commitment like you have, you can get it done your way.
Yeah.
And you did that as now a tenured associate professor. We have a pathway for more scholars like her.
Absolutely.
Dr. Dyer, I'm going to bring Dr. Chi-Chi in on this too, because I agree with everything you said. But a lot of times we have people who look like us who are a part of systems, who sustain those same systems, right?
I know.
We have the delusion of inclusion, right? Right. So so the question that I asked initially was not that we have a legitimate reason to distrust the system. We do, right? I think we can agree to that. But what have you seen that's changing in the system that you can articulate to say that, they are trying to do better. They are now becoming more trustworthy. And I'm going to ask you that, Dr. Chi-Chi Smith. So I'm giving you a heads up to let you know that I'm throwing the ball at you after that. Have you seen anything? Go,
Oh,
no,
I'm
I'm
sorry.
I'm coming to you, Dr. Smith. I
Okay.
was I didn't finish that with Dr. Dreyer, so I want to finish up with her, and then I'm coming to you with the same question.
Okay.
I'm gonna go. This is a really, really tough question because it's like you're asking me, have I seen? Because again, systems level behavior is the problem. So, I'm all for the liberation of Black people and our minds and the things that we do. I will have to sort of harken back to that's my favorite word tonight. I don't know why I'm saying it. I don't know. But Dr. Thomas, in that when I came to Maryland, I'm gonna tell you the truth. I was lost. I was a little bit of a lost soul, a lot of it. Wasn't really sure about whether this is the right path for me or anything.
Mm-hmm.
But what it really took was someone who looked like me to say, you have a responsibility to your community to do better and to do something different. And no, you cannot exhibit that same systems level behavior in which you were trained. Because I was at UCLA,
Mm-hmm.
the system, and with the Hopkins, the system, the system.
Tormentors.
Right. And so it was put on my shoulders that I had a responsibility. So I see that. I see it with Dr. Wilson and Dr. Thomas, who I'm talking about, and Dr. Fryer and all of we call ourselves agents of change.
There you go.
So we have a whole little posse of faculty at University of Maryland, and we are the ones, we stand up to the dean, we go to the dean's office, we're like, this has got to stop, et cetera, et cetera. So again, we're a communal culture. That's what we do, right? So what we do is we build our strength by bringing in the people and saying, we got to do better. We cannot replicate the same stuff that we know is going to end us in the same place, Black people. And so it's tough because the system is a system. And so the people that are like at the higher ups, they all look the same, right?
Right.
I'm the only Black epidemiologist in my entire department. The only. So that means I get all the Black students, all the Black people. Everybody want to work. I'm just like, I'm smoked, I'm tired. But I have a responsibility to them so that I can show them it is your job to go and do the work that you need to do and to not exhibit the systems level behavior that is going to result in the oppression and this continued shackling of Black people mentally and emotionally and spiritually and physically. And just our health is a manifestation of all of that generational trauma and we haven't healed yet. And so I think that's it. I don't know if I'm answering the question because have I seen it?
Come on.
I think I'm starting to see it.
you know what I want us to do? I want us to talk it out. That's right. So you're answering my questions because you're being honest and you're being authentic. That's all we ever ask the people.
That's right.
Okay.
And you may not have all the answers because none of us do. We have some of the answers. We all are possessors of some truth. And as we bring our truths together, then do we get closer to the truth.
That's right.
So you shared your truth, and I'm appreciative of it, and I'm appreciative of your authenticity and your willingness to express the fact that you may not know everything about this, right?
Thank you.
That's critically important. Dr. Smith, help me out with this because I know that when you get people who are at certain levels, people expect those people to be able to go into systems and just change them all of a sudden, alakazam, presto, right? And so how do you navigate this notion of gradualism in terms of system changing versus do nothingism, which is just the status quo?
I've seen a difference since I've been in the public health space. I have seen some kind of improvement. Little itty bitty, not a lot, but we're heading in the right direction. Now, taking our state, for example, our state is not a progressive state. We have a lot of policies that really hinder the growth and the work of public health. I remember when I first started out and I was out more in the community on the ground, there was a lady who, when I talked to her, she was also a Black woman. She had been with the organization for over 25 years. She retired, I believe, last year. But when I told her, okay, this is what I want to do, this is what I want to see for people of color and marginalized populations, she laughed so hard. She laughed so hard. I don't think I've ever heard anybody laugh so hard. But she wasn't laughing to make me feel defeated. She was laughing to say, child, I've been here. And they have cut me down, and I'm tired. But she said, you're standing on my shoulders now. And I encourage you to continue fighting. But she said, one thing she said is, don't do this fight by yourself.
Okay.
You need allies. And as you go higher, bring in your folks as well. And so as I have grown in my career and within the organization and moved up into management and leadership, one of the things I've made sure I do is to hire people who look like the communities they serve.
All right.
Because there is no way. I mean, you have people sitting at the table making decisions about people who they know nothing about. I was recently in a meeting and some lovely human being brought up the fact that safe spaces is a divisive term. It took the grace of God for me to not go across the table.
Okay.
Like the grace of God. I was like, are you kidding me? Employees need a safe space for them to be. I mean, we have a whole pandemic happening.
Yes.
In case you haven't noticed, people's mental health are being affected in all different kinds of ways. People are losing their minds. And they need a place where they can take a break for a second and just let it out. And you're telling me that a safe space is divisive?
You know, when we're talking about perspective, and I want to bring James, I want to bring you on in this conversation because you're a communicator, man. And people know you through your voice. You can walk someplace and people maybe never seen you, but they'll hear your voice and they'll say, that's James Cain, right? Or whatever your radio handle is, right? They'll know you by your voice. So you have established a relationship with the public just through your voice. Now, the question is, how do you now, make sure that your bona fides in the Black community is not tarnished by being a part of a system that people feel that you just kind of use you to get to them, but not to do what they need to do by them?
All right.
What's kind of like Dr. Dyer had said, you can't forget where you came from. And when I go to the barbershop, we have normal conversations. I don't throw around that, that I work for the Department of Health. When we was in the middle of that, trying to get everybody vaccinated. So I think that's what helped also. And our people, they want to hear it from the hip. They don't want to hear nothing, watered down, coated down, or they don't want to hear about no policy. They want to hear, straightforward. And one thing I've noticed, and we talked about this earlier on our call earlier, Dr. Thomas, is we want to convey instead of convince.
That's right.
Our people are tired of everybody trying to convince them to take the shot. So let's sit here and tell them why we took the shot and explain reasons why you should instead of enforcing. Because one thing about our people, when they feel like their back's against the wall, they get small and they want to run. Some people can't handle pressure. And I think that's a lot that's going on too. Just hearing people in the barbershop, they're tired of, but I'm tired of you telling me why I should take this and all that. And I'm sure y'all caught that. Meg caught that from Mr. Leonard Hall as well. He's one of those ones. But we just need to go into a convey instead of convince. And that's what I try to do when I talk to people.
Mm-hmm. You know, it's interesting that you said that, you know, Danny, I was very, you know, interested and compelled by your story, your journey, right?
Indeed.
Where you had to find your space and place, you know, wanted to be an attorney first, but then finding that, you know, it was something else, a calling for you. Tell me how you have, from another perspective, if you notice you on this panel, you come from another angle. So from your angle, what do you see in terms of health disparities, the lack of connectivity to communities of color? And what, from your space, do you think we need to do to enhance that legitimate, authentic, honest relationship?
I really think that it boils down to exactly what Kane said, that I think that people are so good at interpreting what a person's intent is when you approach them. You know, you think that you've got this mask on and that you're portraying yourself a certain way, but people can tell pretty quick what your intentions are, and you let it slip in your words and your actions. And I think that that's what's missing in so many parts of public health, is that people are not actually trying to help people in a way that actually works for them. You know, so when I think about it, and of course everything is COVID related now, when I go out to my events that we do when we're doing screenings, and we don't do vaccinations, but we talk to people about vaccinations because that's what's on everybody's mind. And the thing is, when you approach someone and you say, well, the COVID-19 pandemic is taking a huge toll on our community, you should consider getting vaccinated. When they say no, your instinct might just be to convince them otherwise. But what I've learned from my time in public health and what I've seen work the best with other people is working with someone to find mitigation strategies that work for them. So we're not always listening to the other person. We're giving information out. We're saying, oh, the COVID-19 vaccine is effective and it's safe and it prevents COVID-19, which is all true. But you know, there are people out there that we all know people like this, who are just, no matter what we say, they're never going to take it. And when we just have that one-sided conversation with someone where no one has a chance to respond back, we don't get to learn the ways that we can help these people stay safe even still. You know, I can't force someone to take a vaccine. I would never force someone to do something that they're not comfortable with. But I would also hate to think that my contribution to public health and to helping create healthier communities is, you know, this one thing or nothing. I would much rather think that we're going out there and we're listening to people, and we're hearing where they're coming from, what their concerns are, you know, what leads them to make the decisions that they make, and then taking them on a path that creates the most realistic path to wellness for them. It's
Right.
kind of, it's something we do. So in the program that I run, which we do in barbershops, one of our components is HIV testing. And that's one of the things that we work on with people when we look at HIV testing is, you know, it's not, abstinence is going to prevent HIV. Of course it is, but it's not realistic for everyone. And if we go out and we preach abstinence to every single person who comes to get tested for us, we're not helping them. You know, so that's an example of what we're talking about, is just getting to know a person enough that I can say, well, where you're at right now, what tools can I give you that help bring you closest to wellness that you can be? So I think we just need to listen, talk less and listen more.
You know,
Mr. Mayor,
go ahead.
Mr. Mayor, I was just going to say what Danny reminds me of is why humility is so important.
Right.
It is the doorway to our common humanity, no matter what your pigmentation may be. And the willingness to change and be flexible on the ground, outstanding. These public health professionals are encouraging me.
Yeah. Well, you know, I'm glad to have this conversation. You know, one of the things, we had this conversation in our inner talks about funding and competitiveness in the funding process, and how a lot of people don't collaborate because we don't build those relationships because we are competing oftentimes for the same money, right? And so when do we get to, and Dr. Dyer, I want to help you. When do we get to the point where it's not about money, it's about saving lives?
There we go.
Right? And why can't we get to that space?
That's a really good question. That's all I have to say. No, that's not all I have to say. No, that is not all I have to say. This is the no pun intended, the $1 million question is how do we get from it's about the money to saving lives? I do believe in my soul. I'm a little Pollyanna. It's really interesting because I believe that for the people that I tend to collaborate with, that is what's at the crux of everything. It's I want to save lives. And so it's interesting that Danny brought up HIV because that is the research that I do. It's HIV and with LGBTQ AI plus populations. And so, but you need the fund. Okay, so here's one of the things, right? So when we talk about ending the HIV epidemic,
okay,
there are 3 steps. One of them is that 90% of people who are living with HIV are virally suppressed. Like that is like the last. But first is test and diagnose, treat, prevent, and then respond to a potential outbreak. At the very, and so the CDC has put the funding behind this, et cetera, et cetera. So there's some money. But at the end of the day, we need some money so that we can build that workforce, right? Okay. And so for me, I think saving lives is at the heart of it. But I think I'm thinking about what Dr. Smith said. We need people in those rooms to be making those decisions about what the stuff is that's going to get pushed forward at the NIH, at RWJ, at NSF, or wherever, right? And it doesn't always have to be these large pots of money. It doesn't take a whole lot to really just, a lot of times what we want to do, we want to, give something back to the community. I don't want to just come in and do some research on you and then just bail and leave. I got to come back and talk to brothers and sisters about, remember when I was here? I'm coming back. Let's talk about what we found out and where do you think we should go from here? That doesn't take a lot. It takes time.
That's
time is money, but not really. It just takes time and love, and you just got to be willing to do it. And sometimes there is no money there. But one of the things that I put on my piece of paper, because I read the title of today's forum, and I was thinking that in order for things to be sustainable, there has to be some promise from government to make it sustainable. And a lot of times that is by putting money into programs so that they can be sustainable when we leave. So the community can take the program over and do it the way that they want it to be done, right?
Right.
And so it just, I don't know, like it requires money, but it really just requires time, effort, and love.
The point that I was making, Dr. Dyer, is that in order to build critical mass, there needs to be collaboration.
Yes.
Or we operate in silos and fiefdoms and we minimize our impact, right? So Dr. Smith, I assume that you would agree with me that we need to partner in order to reach more people, right? That's what I was speaking of, Dr. Dyer. Was this notion that operating in these fiefdoms and silos is marginalizing our impact?
Yes.
Absolutely. Collaboration and partnership is key to having an impact in anything that we do. We can't do things by ourselves. We cannot not talk to other people because at some point, the communities we serve can get really frustrated when they hear the same things from different people. You have one group of people, from the health department go into a community and talk about, diabetes, heart disease, here's what we can do. Next week, another group from the same health department goes into the same community, talks about the same thing. And before you know it, the community is like, do you all talk to each other? Why do you claim you're from the same place but y'all were here last week talking about the same things, and we're like, no, we weren't here last week. So collaboration and communication is key to making any impact. And I want to talk a little bit about what Dr. Dyer raised when she mentioned time and money. It takes time, like you said, to go into communities and build trust. But sometimes money cannot wait for time, especially in the policy space, because somehow, as public health practitioners and researchers, we have to be able to show the work that we do, the importance of the work that we do, and why we need the money. Public health takes time, prevention takes time. And if you look over the years, I mean, funding has been cut from public health a lot because what we do is behind the scenes. We prevent stuff so you don't see it. And now COVID-19 came and all of this money from everywhere is coming through because, oh my goodness, now people see it. So that's that's one of the major problems with time and funding, is that it takes time to build relationships, to build trust, to make an impact. But then sometimes policymakers take that money because they're not seeing results. Public health it's not a noun thing, it's over time. And so if we can educate people, lawmakers, about communities, advocate groups, so community members can advocate for themselves with their policy or senators and representatives and say, hey, you can't cut this funding because it's gonna take time. And that's why I'm really big on education, because knowledge is power. Right. We have to go out and educate communities and give them the tools to fight for themselves. Because as government officials, we cannot go lobby, we cannot, we can advocate, but then there's a thin line between advocacy and lobbying.
You're talking about going to the legislature and places like that. You can't not do that, is what
you're
saying.
But we can work with community members. Yes. We can work with barbers, beauticians, cosmetologists.
There we go. All
right.
So you can go vicariously
can
through
go
them.
Back. Yes, you can take the message to your representatives and tell them, we need this funding to stay. And they'll listen to you because you vote.
Right. One of the challenges, and I'm going to bring some people on because we got barbers and we got a special barber down in Arkansas, a stylist down in Arkansas from
Pine Bluff.
Not, I want to make sure I get it right. Right. Dorothy Reynolds, we want to bring her on and then we're going to go. And I want Meg, if we can run the numbers a little bit after that. We want to also get a pulse of where we are, because we not done that, the word cloud. But Dorothy Reynolds has been with us for a long time, and we just always love to see her and to hear her story and to know the work that she's doing in Arkansas. So, hey, Dorothy Reynolds, how are you doing today? Unmute for me.
I'm doing fine. How are you all?
Good. Do you see your folk up in the house?
Yes, thank you all so much.
Mr. Mayor, I want to kind of set the stage for Ms. Reynolds, because it was a phone call I received from her as she volunteered herself to be part of the Shots at the Shop program. And so here's someone out in the community trying to make a difference. Picking up the phone, calling that big system, the health department, and wanting help. And by just meeting her in these Hollywood squares, I get to meet Mr. Kane. And we did a conference call together, and the rest is history. Dorothy's shop has taken off. She's a role model across the entire state of Arkansas. And Dorothy, now they want to take your model all over the state. But tell us a little bit how the early beginnings of how you found the courage to even take on this challenge.
Well, it all started when our mayor, Shirley Washington, called me, and she knew our shop was crisscross street from the city hall. And I've known her since 1966, so we trust each other. But
Okay.
anyway, she called me and told me what was going on and asked me if I was interested. And I was very interested simply because we had lost our brother-in-law who was developmentally delayed to COVID.
Mm.
And it was so traumatic on us because we couldn't be there for him and they didn't understand him. And
Mhm.
so my first thought was this would be an outlet for us to let, which I was looking for an avenue to let other people know how devastating the virus is. So if you can get a vaccination to prevent it, do it.
Mhm.
So after she told me to call Dr. Smith was so encouraging and gave me all the information to contact Mr. Kane. And I contact Mr. Kane and talk to him and let him know that I'm.
We got just
It'll,
for
ki-
1
it'll kick
second, we
back in.
got
Well, I'll tell you one
pause for a
thing,
minute.
Mr. Mayor. I'll tell you one thing, Mr. Mayor. Whatever
Mhm.
she let him know,
He's still
he got
smiling
it.
about it. I'm telling you, go ahead. You back.
You're back,
go,
Dorothy.
go ahead, Dorothy. You
Okay,
back. Go ahead.
anyway, so after I talked with him, the ball started rolling. Before though, I called you because I didn't know what to do. I wasn't sure what my responsibility was going to be and how the salon could impact the situation. So when I talked to Mr. Kane, he told me everything and he was so calm and encouraging. So I felt very comfortable that we could do this in our shop. And from there, it was on. We picked the date. And as I told you earlier, flyers, we have flyers all over the shop. The flyers start the communication. You don't have to go up to people and say, have you been vaccinated? Because the question is already on a flyer on the wall. They know we're going to talk about shots in there. But
Okay.
he had this flyer made for me.
All
And
right.
we had them all over town, the radio stations, churches, all in our beauty salon and barbershop. And people were interested in finding out about it. And then the mayor made it even sweeter by offering to give everybody that was vaccinated a $25 gift card.
All right.
Yeah.
So after we conduct the first round of shots in the shop, people started calling and saying, when are you all going to do that again? So I didn't know we could do it again. So I called James and he said, oh yeah, you can do it as many times as you need to.
That's wonderful.
What are you up to now?
Yeah.
Well, we did another shots and the first one was November 20th and the second one was December 18th, I think. And now Danny, I don't see him anymore, Danny Baxter,
Uh-huh.
Yeah, he'll be back.
contact me and we were talking about underlying problems. A lot of people were saying why they couldn't take the vaccination because they had this problem and that problem. And he was explaining to me that those problems are some of the reasons why people don't get well so quick
Mm-hmm.
because they have these underlying problems.
Mhm.
And so he called me and asked, would we like to do another event at the shop? But it's so big, we can't have it at the shop. We're going to do it down the street from the shop. It's called the Generator. And it's where we can have professional public meetings.
Yes.
And so Danny asked me if we could do the HIV and high blood pressure event. So we told him yes. Well, first we had to think about it and see how it would work in our shop.
Mm-hmm.
And I talked with the barbers and they all were excited about it because all of them have high blood pressure.
Okay.
Mhm.
And so, including my family members have high blood pressure. And so, we found out today that we could get a date on April 2nd is the best date because of spring break. But we are looking forward to conducting that particular event for Danny. He is with the State Health Department, as you just heard, and he will help us to spread the word and get the information out along with Mr. Kane, so that people can know that, can find out and get information that would help them make a decision, knowing these underlying problems could make the virus even worse.
Right.
So they would be ready when we do our second round with shots in the shop.
Thank you so much.
Mr. Mayor, I just want to point out how Ms. Dorothy Reynolds talked about Danny, like they're friends, like they know each other.
They
Like
are friends.
She got a friend on the other end of the phone.
It's important relationships.
Absolutely.
Even when we're talking, earlier, Dr. Tiffany Dreyer said, call me Tiffany. And people didn't know she was a doctor till much later, right?
Mm-hmm.
Right. The point of the matter is that we got to be real with people. I think that's going to make the difference, right?
Mm-hmm.
Authenticity, transparency, honesty, right? Relationship building. And that's not going to happen overnight. And if we cannot figure out a way to do, this thing called, measuring our outcomes differently, right?
Mm-hmm.
Because if you're just talking about shots in the shop, and you're just talking about shots, and you're not talking about the people who came from the hell no wall to the consideration, and look at that as being a success.
There you go.
I think we need to manage expectations a little differently.
Absolutely.
Even as we write grants, because there may be, you can't just say that this is going to be like a Alakazam Presto thing.
No.
Right? Now, I want to talk a little bit about, because I'm going to bring Meg up. Dr. Dreyer, you mentioned this. We talked about sustainability. Isn't it better to do sustainability by inculcating what you're doing into institutions that's going to always be there, like the barbershops, like the churches, like the funeral homes, like the different places that's already there? So you go vicariously into those, build those institutions up so that they can maintain these even when the money leaves.
That's right. Absolutely. And I think what Dr. Smith was saying as well, and I think most of us are saying this, is also building those partnerships again, and really partnering with the community and partnering with those organizations and those institutions outside of the ivory tower, if you will, because those are the people who have a vested interest in sustaining those programs and making sure that they work and that they're effective and efficient and that they have a long life.
Dr. Dyer, it's good to know that there are Dorothy Reynolds out there in the world who are willing to step up, and for her to go from not doing anything like this to having multiple events with her health department is just a sign that we're on the right direction, and we got new partners on the front line. So let's give Dorothy some snaps for what's going on there in Arkansas.
Arkansas is in the house. I told you, Miss Lucille Cameron, she's my dear friend in Little Rock, Arkansas as well. I keep talking about her because I love that girl. All right, here we go. Let's Meg, tell us, I think sometimes we start talking about deaths like it's a statistic.
Yeah.
These are lives, these are families, right? Yeah. And we need to be more mindful of the fact that and give more respect to the fact that each one of these people represent something more than just a statistic. Talk a little bit about the number of people in the last few weeks, Meg, that we have.
Yeah. So I'm going to run the numbers officially next week because we want to talk about testing tonight. But I do have the numbers. I always have the numbers. So at this point, 78.7 million people in America have gotten COVID in the past 2 years officially. We know that more people have gotten COVID than that and just not gotten tested. At this point, 941,000 people have passed away. And that 214 million people have gotten vaccinated, but only 93.2 million people have gotten boosted.
Wow. Yeah. Right. That's another thing. You and I talked about it earlier. Yeah. We have not talked about boosting enough. Why is that? Tell me we didn't get everybody vaccinated for the first two, Pfizer and Moderna and Johnson and Johnson. But the people who got those, why are they hesitant about getting boosted? Is it that we did not manage this right? Interesting.
Yeah. I think there's not one answer, there's 12 answers, right? I think that's true of a lot of COVID questions, but I think we talk a lot about managing expectations. And when the shots were made, there weren't boosters. We said, maybe we're going to need them. New variants are coming. We might need more shots, but we didn't have them at the time. And so it wasn't, okay, you're going to get 3 shots and that's how it is. You're going to get 4, you're going to get 5. There was no information like that. I think that's part of it.
Maybe we should have said that we don't know how many shots you're going to need right now, but as we go, right, we'll let you know, right? So to come up with something definitive, you remember, Dr. T, we talked about July, right, 4th, right? That
Freedom
the
Day.
pandemic's going to dissipate on July 4th, right? Managing expectations is critically important. I'm not going to hop on that. That's a whole nother show. Let's do that. Meg, tell us a public health a minute.
All right, everybody. This week, I want to talk about rapid testing. Rapid testing, I think, has gotten a bad rap, which is kind of why I want to talk about it. Maggie, if you could pop up the slides real quick, because actually the third one, please, with the QR code. So I don't know if everybody's heard, so I'm just going to mention it again. You can get 4 tests for free from the federal government. If you go to this website or you scan that QR code with your phone, you can just use your camera and it'll see it. So you can order 4 rapid tests. You can pull that down, Maggie. So here's one of my 4 rapid tests. These are different across America. But I thought I'd talk to you tonight about, you got these in the mail. What do I do with this? And also, what can it tell you? Okay, so I have a type that has a tube and a swab. There's lots of different types. You've seen the Binax ones, maybe. It's got a placard and then you stick a long swab into it, right? They're gonna have instructions, a huge page of instructions. So the very first thing you're gonna do, I read this 3 times. I'm not kidding. I sit down, I read it, I think about it. I do it once, I do it again, and then I do my test. I don't touch any of these things until I've read this 3 times. The other thing, they've got QR codes now. So this one, you can watch a video of someone doing this. Don't get scared of this big piece of paper because this is everything that you're gonna need for this rapid test. Okay, so when do you use a rapid test? Rapid tests, the reason they get that bad rap is because they're not as sensitive. They don't always pick it up when you're positive, right? So the best time to use a rapid test is about 5 to 7 days after you were with somebody who had COVID. Somebody calls you on the phone and says, hey, I got COVID, and I saw you 3 days ago. You go 1, 2, 3, 4, 5, and you get tested on that. You can use this home test on the 5th, 6th, or 7th day, and it's going to give you the most accurate result. So you test on the 5th day, it came back negative, which is great. On that 6th day, you still feel sick. You need to test again. You need to do a rapid test again, or you need to go do a PCR, because this actually happened to my family last week. The kids felt sick, they tested once, everybody was negative, they tested again the very next day, and my niece was positive. You need to test multiple times if you're feeling sick. Please don't take one test as the answer. If you get a positive on a rapid test, it's very, very accurate. If you get a positive on that rapid test, you have COVID. And you need to isolate yourself up to 10 days. So, Maggie, can you throw the slide up so I think I got everything?
That may be the first time for many people having it broken down, like you say, Mayor, where the cows can get it.
Right. Well, part of it has to do with the fact that you get this big old piece of paper And, you know, I mean, that
Yeah.
looks intimidating to me. You know, I mean,
Right.
good gracious. I mean, maybe we do need to give people a kind of video, a short video where they can go and walk them through the process, right? That
Yeah.
may be a better way to do it. And so say, go to this place, put your camera on here, the QR code, and it will take you to a video that will walk you step by step. Maybe that's a better way to do it.
Now, Maggie,
Yeah.
are you trying to share a screen?
Hey, Maggie, it's other monitor.
The slides are not up.
Yeah. We
There we go. She'll
looking at
switch.
music.
Happens to everybody.
Yeah.
Switch over.
So yeah,
But that was a very, very nice presentation, and not be intimidated by that paper.
Right.
No.
Right. That's powerful. Thanks, Meg.
yeah.
Meg Jordan. She's part of our team. We're so appreciative. What
ready for the
we're
pulse
gonna
beat?
do? Let's get a pulse beat. Dr. T, let's do the word cloud quickly.
Well, I'm so glad to have our friends from Arkansas here to be part of this part of the program. And Dr. Dyer, what we have is to ask you this question. Think of a word right now. Yeah. Think of a word right now that best reflects how you're feeling at this moment in the pandemic. Just think of that word. And behind the scenes, our crew is going to build a word cloud. We're going to take like just 60 seconds. Now, enter the word right there in the chat.
Oh,
And then
that's
put as
easy.
many words as you
Okay.
want, just as many words as you want, one at a time in the chat that reflects how you're feeling right now. For those out there in Facebook land and the live stream and cyberspace, you can do it in your chat or the Q&A box. Our crew will let us know when the cloud is ready. And Mr. Mayor, I am really interested in what people are feeling right now as the news on the front pages is changing.
Right.
And we may see less COVID information. At the same time, I have a class tomorrow. And I've got at least 3 or 4 students that already called in that they have COVID or they've been
Right.
exposed to someone who has
Yeah,
it.
at least they-
So this has
Right.
not gone away by
Right,
any means.
That's the problem. It's like we spiked the ball on the 30-yard line. That's not a touchdown. That's a fumble. You know, and we, you know, I don't, because now we got a war that's in the news. People are not talking about it. Out of sight, out of mind.
There you go.
Right.
But you know, in the barbershops, we can keep the conversation going.
That's the point. We have a place to keep the music playing, keep the conversation going, right?
and making sure they have
what we're gonna do.
supplies.
Yeah, absolutely. We need to do that. Let's bring up some more people. We got some folk up. Let's bring up Sandra Jenkins first, and then Dr. Sharon Cooper. Be on standby. Hey, Sandra
Hey.
Jenkins,
Hey.
how are you doing?
I'm doing well. I'm doing okay.
Good. Tell us what's going on in your world.
Oh boy, and my world is just really trying to absorb everything that's here tonight. It seems as though I'm touching on everything that Dr. Dyer and Dr. Smith and Mr. Kane and the other gentleman. I don't know where he.
Yeah, he had to leave
Yeah.
early.
Yeah, Danny had to go.
It was just
Baxter.
so
Yes,
relevant to what I'm experiencing right now. And I just would like to say that we're on the road to something that is very let's just say it's just really heart-wrenching to know that the team that I'm working with now, we're on one accord. We are on one accord to work together to make this thing a relevant issue in the barber and beauty industry. It seemed as though the barber and beauty industry is somewhat, just sort of just glazed over. I mean, we talk about restaurants and the importance of safe practices, but we really need to work on that in the barber and beauty industry. And we're working very diligently where we are now. We have our students that are currently under apprenticeship that we're working and collaborating this initiative into their learning practices. So this is just amazing.
Tell people where you are, Sandra Jenkins.
I'm from Philadelphia, Pennsylvania. Currently, I live in Montgomery County, Pennsylvania, but I like to claim Philly too. I'm always keeping my brotherly love with me. So that's where I am. Yeah.
Thank you so much.
Okay.
Dr. Sharon Cooper, thank you so much. It's always good to see you. And
Good
really,
evening,
your
everyone.
perspective always does. Hey, Dr. Cooper, how you doing?
All is well. And as I can share with Ms. Jenkins has said, this is inspiring. This is part of that reimagining healthcare. And all about cultivating that relationship and building those community, what we call relationships to forge in a direction of changing healthcare outcomes. We have to move away, as the mayor said, from that single agency approach, those silos, and shift it to that collaboration, which can result in leveraging those necessary resources in order to be even more impactful and having greater outcomes. And using what I love about this group, and I'm going to just be silent after this, is the fact that we're using this knowledge, building upon it, generating new knowledge and applying it to practices. That's the uniqueness, the beauty of all this, making it happen. And Dr. Dyer, I was born in South Philly, raised in SoCal, went to USC, so we need to connect. I'm on the campus.
Right, wonderful.
We need to connect.
Rams, okay?
Yes, thank you.
Mr. Mayor, did you hear what she's describing? She's describing that coming into these Hollywood squares.
Right.
That's what she's taken away.
Right.
We sit in these squares all day long, Zooming, being drained.
Yes.
And you come here to a wellspring of knowledge. Let's give up some snaps. We got even more coming tonight.
Dr. Cooper, I mean, the way that you capsulated that, it was incredible. You really nailed it. I mean, thank you so much for what you do. This notion of public health, I have to admit, I didn't really know what y'all did before now. I really didn't. I mean, I was like your grandmama, Dr. Dyer. Your mother and your father. I didn't really, I knew Dr. T and other folk in the industry, but I never really thought about what you all did in terms of anything that was going to be this relevant in my life.
Yeah.
Right. Everybody is public health.
Yes.
Right. And we have to begin to see ourselves as a part of this movement of public health to keep the public safe and healthy, right? And that's what this is all about. And so I appreciate having this conversation and the importance of this collaboration. Let's bring some more folk up. We got so many people in the background. Let's go to the back. Let's go bring somebody up. Let's go to Mr. Mike Dynamite Brown. Let's bring him up. Now, let me tell you something. You get these people that end up being stars. You don't plan to be a star. Then we're going to bring up Dr. Ritter. Let's bring up Dr. Ritter, bring up Dr. Dynamite Brown, and then we bring up Dr. Ritter. Since Dr. Ritter's here, let's start with her. Hey, Dr. Ritter, how you doing?
Unmute yourself.
Yeah, this has been phenomenal. I mean, I don't think I've been in a room with this many public health people ever. And, I'm in the other, I don't even know, I was trying to figure out the antonym for public health and medicine. I mean, they're, like biologic, with a pharmaceutical surgical medicine, that's what I'm in. So this is kind of great to collaborate with the health part of medicine, public health.
Tell our friends in Arkansas a little bit about what you do.
I'm a gynecologist in Baltimore, Maryland. And I stopped delivering babies about 10 years ago, but I've been doing this for 3 decades. So I've seen the intersection of health and women for many, many years. That's where my focus has been. And I see the race issue, very clearly in women's health. The inequities are phenomenal. And the politicization of gynecology, has been at the forefront of who elects our politicians. So we have a lot in common with the conversations of inequity here.
I wonder also, just want to say that she brings also the the State of Maryland Medical Society, the MedChi Society, has been bringing these conversations into those arenas as well. So we are onto something. I think we're onto something that could be transformative.
You know, one of the things, and I think that the honesty and the willingness for Dr. Ritter to say, you know, I can now see from another perspective, but that I want to learn, and that I'm open.
You know what I was
to,
called this
yeah, go
week?
ahead.
I'm sorry to interrupt you,
No,
but I have to
go
tell
ahead,
you
Dr. Ritter.
this.
No, go ahead.
I was called the canary in the coal mine.
Tell me what that means. Context.
I don't know what that means, but that's what they call me because
who's
I'm
the they?
showing a different
the they?
story to the groups that I sit with, which are like white people, right? And to having conversations about medicine and just using the words that I've heard from the barbers and the stylists and the public health people, and they're like, what is this? This is like that taking the oxygen out of the air, that we were just going to go down this path, right? We were going to go down this path because this is the path we've always gone down. But then I like bring this up, and so these conversations have not really been even, you know, thought about by some people.
Are they uncomfortable conversations?
Holy crap, yes.
Interesting.
Wow.
I get exhausted.
Yeah.
That's why my word was discombobulated.
Would it be fair to say that in some of those rooms, you're in rooms that people who have power, have privilege, have some control over the system?
Oh yeah.
And
They
so when
do.
you come
They
into
think
that
they
same
do.
room and you bring some of the voices of those who have lost all hope in that system, are you saying that you then get marginalized yourself?
Well, I haven't been yet because a lot of these people I haven't met in person either. It's hard to be marginalized in a Zoom meeting.
Yeah, well,
That's
believe you me,
interesting.
they'll figure out a way to do that, Dr.
But
Ritter,
anyway, the
that's-
canary in the coal mine didn't sound good because, like, you know, what happens to the canary. So I'm
Right.
The canary in the coal
You're
mine,
alerting people to
they
danger.
would let him go down first.
Yeah, wow.
exactly.
Yeah.
But you
Canary
can
would die and
also
everyone left.
you can
Yeah.
also let it be known, Dr. Ritter, in those spaces that it's all right down here, or it's all right over here, that the air is even fresher, because as Mayor has said, we've got to let it out in spaces that we can still maintain our relationships.
You know what I don't understand? Why can't we just be honest and truthful with each other? I don't understand that. Is that naive for me to say that? I mean, you know, why can't we just be honest? Because that's the only reason why people are going to ever trust you, is if they think that you're honest, right? People don't trust dishonest people that they know are dishonest, right? And I think that's important. Why did we bring Mike up? I got you, Andre. Since you started talking, they brought
There
you
you
up
go.
anyway, you know, so.
And the cloud is ready. The cloud is ready.
Okay, the cloud's ready. But we got Dynamite Mike. Hey man, how you doing?
Hey man, how you doing?
I'm doing good. You know, this conversation, man, I'm sure is very similar to the conversations that you have in the barbershop, right?
Absolutely. And from my platform, it's so diverse. It's predominantly all Black people, but I have segments of African, segments of white, segments of Latino American. And from looking at these panels week after week, it's just amazing that we have these type of people on our forefront that's working with us, that we could have them in the barbershop speaking at any given time. Now, on this panel right here, I would take Dr. Dyer. She could work every day with me, every day of the week. And then Dr. Ritter, then Dr. Kane, MMC Kane, Mr. Kane there. These guys that I can relate with. So I like to call myself, if you had to reach your hand into the bag of the community, I think you will pull me out. So I am the people that you're talking about. So I can identify with Dr. Dyer all day. She meets every walk of the clients that I have.
Yes.
She meets every level of them, and she can talk to them on their level. It's an
Thank
instant
you.
win with her.
Wow.
Dr. Kane and Dr. Smith as well. I mean, and Dr. Ritter, just everybody community together
Yes.
has a point where we can
Yes.
patch up some of the holes that gets leaked out in the misinformation. We can patch them out. Each one of you can patch the holes where the misinformation comes, and we can contain them in and get them where they need to be. We just work together. I love it.
Yeah.
Man,
I'm gonna get off.
you know that's powerful, man. That's powerful. I'm going to show y'all something before we leave. Let me do this. We do have
Get that cloud up there.
Let's do the cloud first. Okay.
This is the pulse beat here. Here we go. Look at this.
Go ahead, Dr. T. While I'm getting something.
Okay. And
Go ahead.
so one of the things that I've been amazed at every week is the power that comes from the word cloud. I'm going to talk to Dr. Dyer here because I want you to see the quality of the conversation we're having in this space, unsanitized, with the barbers and the public health professionals and the physicians together. What other spaces have you seen that? Now take a look there in that word cloud. What jumps out at you? Dr. Dyer, what jumps out at you? What do you see?
Empower jumps out, but then I see piss.
Well, go ahead, put a heartbeat on whatever you see. Put a heartbeat on it.
Put my heartbeat. Wait, hold on. What we talking about?
No, just describe what you're seeing there.
Okay, so I see what you're saying. Like my heart. Okay. This point in the pandemic, I see piss. I think it's because of the way that it's been handled. I think we have hope, but at the same time, we can't forget at the beginning of this pandemic, it was just raggedy. And so people are still upset about that. We're upset because we didn't have to lose as many people as we did.
Okay.
And we know that it affected our communities, again, more than it affected other communities, so to speak. And so we didn't have unnecessary deaths, unnecessary cases. And I think this is also why we were talking about the fact that it's like fumbling the ball at the 30-yard line. That's not good. That's you fumble. That ain't, And so is it too early to stop the mitigation measures? CDC said no mask tomorrow.
Unbelievable.
Like, what? We know what happened in Denmark. Same thing. Skyrocketed the cases. As an epidemiologist, that's all I do. So I think people are pissed because we know we live in a community where if something pops off again, it's gonna be us. And so we don't like that. We need people to look out for us. We need to look out for ourselves.
Mr. Kane, what do you see there? What do you see in that cloud?
Man, I feel impactful.
Okay.
The reason why I feel impactful because, I feel like some of the stuff that we've done around here as far as our commercials, PSAs, and I'm just gonna brag if I can with Miss Dorothy.
Okay.
with Miss Dorothy on here, and Miss Dorothy just don't know that I thank God for her that she came into our lives to the ADH because we need people like Miss Dorothy to be a spokesperson for us. And the thing, and I was just talking to Dr. Chichi, is that we have to be involved in the community. And Mayor Omar, that working in radio, it's important for radio to be engaged in the community. And I think public health has to be engaged in the community because if you give back to the community is going to listen to you and give back to you.
That's right.
There's a disconnect, and we got to connect public health to the community. So when we go out here and advocate for what we're doing, then they'll believe us. And then it won't be no question about, is this for this or this? Okay, we got to be involved, whether that's with funds or helping them with what they're trying to do. But there's a disconnect between the community and public health, and everybody knows that public health is community. But what we got to do is get back to where they're connected.
That's where that trustworthiness comes in, Mr. Mayor. Hey, Dr. Smith, what do you see in that word cloud? Put a heartbeat on it.
I see tired. And it reflects how I feel, how a lot of my colleagues feel. because it looks like we've been fighting and just losing this battle and this war. We have tried to, highlight and raise our communities and to show people in these rooms, this is why we need to focus on BIPOC communities. But the questions we get back, how about other people? Health equity is not just BIPOC people. And
interesting.
The tiredness I feel, I cannot imagine how members of our community outside are feeling, because they're getting mixed messages. Like Dr. Dyer was saying, it's okay not to wear a mask today. Well, then you have to wear a mask tomorrow. Make up your mind. What are you saying? What are you telling us? And we can stay open today, but then we have to close tomorrow. We're getting mixed messages. We're sending, it's exhausting. I see tired, but I also see determined.
Okay.
Because no matter what obstacles, barriers that are placed in front of us by people in those rooms who look nothing like us, who do not understand what our situations are, where we come from, our lived experiences, we will keep fighting.
Mm-hmm.
We will keep fighting until we win this battle, until we make it into those rooms and become one or more of the decision makers.
Okay.
And when we start making decisions, we will make positive decisions that will positively impact our communities. And so we're determined, and we're going to keep fighting.
Thank you so much, Dr. Smith. Let's take the word cloud down.
Mr. Mayor,
now.
can you believe it's 8:27? Can you believe that?
Time flies when you're having fun, right? That's what's happening.
Hey, we
right?
didn't even get Katrina up here. You better get her up.
Right. Let's bring Katrina up to let's bring everybody up to say hi. And hey Katrina, how you doing?
Unmute yourself.
We got 2 minutes, and I'm going to do a closing.
Hello there, Dr. Omar. How are you?
How are you doing?
I'm great.
It's so wonderful. You talking about a wonderful spirit. Katrina Randolph, you are a beautiful spirit. We are so appreciative of you. You just, you brighten my day. I promise you every time I see
this is just real quick.
Great. That's great to hear.
Absolutely.
Real quick, she just did a video on the flu vaccine. We'll make sure everybody out there gets it. Katrina, just put that together for the
absolutely wonderful.
So
we're proud of her. Andre Russell, I love you.
Andre.
We got a short time, and I got to go to Rejuvenate, but just a little bit, just to say hello. Okay, go ahead.
Unmute, Andre.
I didn't know you also wanted me to talk. I'm always impressed with our panelists. It's a great thing. And Dr. Dyer said something that I'm extremely involved in about funding, because people do not realize what's going on without some type of funding behind it. Mm-hmm. And I've brought up funding before with you guys, and now I'm going into a grant writing thing. However, my funding is out there for everyone to see. I've been doing this in Atlanta for quite some time. And I currently have a barbershop at the airport. They always want me to say that.
Absolutely. and thank you so much for saying that, because that's the end for the day. I love you so much, man. I promise you. We gonna have a skit, just you and I. We figured out. I love you so much. Stacy, say something. I know we got you at the end. I'm gonna make you one of the panelists soon. Go ahead.
Okay, I just wanted to say hello, everyone. Everything is great here in Montgomery County, Philadelphia, my hometown. And I love you guys. Peace.
Absolutely. All right. Well, right. The clock on the walls, because I don't know, how do we ever we can't get out of here in time. Somehow.
It's really good. And I'm so glad Dr. Dyer could come and see this. Tell the faculty, all right?
Right.
What you got, Omar?
Let me tell you this. Mike brought this up, right? So bring Dynamite Mike up as we get ready to leave.
I'm here.
You remember when you talked about we got to all plug? Well, this is an African symbol. I got this when I was in Benin, Africa. In fact,
Wow.
I was over there with Diane Cameron. And the notion is that everybody plugged the hole.
Oh, wow.
You see what I'm saying? Everybody has to do their part. And when we all plug the hole, that's when we can maintain the substance.
Yes. Yes.
Right?
You all didn't talk to each other ahead of this.
Right,
No,
right. You
we
see what I'm saying?
didn't.
Right. That's
Come on.
the ancestor saying,
There
man,
we
you
go.
right.
Come on.
You got it?
Nigeria
That's the
in the house.
ancestor
Give the
saying you
snaps up.
right.
Okay.
Plug the hole.
He had it right there.
So our closing,
Come on.
our closing today is merely this: plug the hole, and we're going to be all right. And as always, I like to leave you with these two words: remember that I love you with a perfect love. But more importantly, remember this: you got the power. Thank you for joining with us with a wonderful section of The Cutting Edge. We'll see you next
All
week.
right.
Same time, same
Thank
station.
you.
Bye-bye.
Have a good night.